My name is Anushka Patel. I'm the Vice Principal Director and Chief Scientist at the George Institute for Global Health, University of New South Wales in Sydney, Australia. And I'm going to be talking about population strategies for hypertension management. So I think the most pertinent issue for hypertension control today is the fact that most people in the world with hypertension, there's about 1 billion people globally estimated to have hypertension, don't have good control. It's only estimated that about 23% of women and 18% of men globally have adequate blood pressure control. And that's very recent data that's been produced just in the last few months. So it really is a major problem and requires, I think, a suite of strategies to address that problem. I think there are two major strategies that I'd like to talk about in terms of population approaches to hypertension management, where we've actually identified some progress in the last couple of years. So one is around how we should treat individuals, and the second is how we should more effectively deliver treatments to those who most need them. So one of the most exciting developments in the how to treat category is a very exciting publication earlier this year around using salt substitutes. There was a study published in the New England Journal of Medicine called the China Salt Substitute Study that focused on people who'd had a recent stroke with hypertension and showed that substituting regular salt with a low sodium high potassium substitute reduced not only blood pressure and cardiovascular events, but also mortality. So that's been an important finding. There are also new ways of using the real plethora of drugs that we've had for decades to treat hypertension more effectively. So the typical way that we treat blood pressure is that we start with one drug at a low dose, and then we slowly increase that dose as needed. And then if we don't have adequate blood pressure control, we add another drug at a low dose and slowly increase that, etc.